The main reason of opening this YouTube channel is to provide answers to the public, especially those that don't have access to useful information. Someone asked, Nurse Mary, what is gonorrhea? Can you please enlighten us about gonorrhea? Definitely, I am here for you. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be talking about that particular topic, gonorrhea. Gonorrhea. What is gonorrhea? What are the causes of gonorrhea? What are the 10 facts am I going to be sharing with you today about gonorrhea? And also, how can gonorrhea be prevented and treated? But before I go into details into this class, if you are new on our YouTube channel, please and kindly click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be talking about gonorrhea so that we have a better understanding of what this particular disease or infection is all about. First of all, what is gonorrhea and what causes gonorrhea? Gonorrhea is a sexually transmitted infection. Yes, it is a sexually transmitted infection that, if not treated, might be dangerous to that particular individual. Gonorrhea is caused by a bacteria known as Neisseria gonorrhea. I'm going to be dropping the spelling so that you can see it. It is caused by a bacteria known as what? Neisseria gonorrhea. The next question that will come to your mind is, how is this gonorrhea transferred from persons to person? This bacteria known as Neisseria gonorrhea, it's usually found in the fluid of the vagina. It's usually found in the fluid of the penis. It's found around inside the penis, the fluid around the penis and the vagina. And it can be transferred through sex. That is why it is a sexually transmitted infection. So in terms of the mode of transfer, it can be transferred through sex. It could be anal sex. It could be oral sex, and it could be penis and vaginal sex. So these are the various sex that can transfer gonorrhea. And also, gonorrhea can be transferred when an individual shares sex toys or vibrators that are not properly washed. So these are the various ways in which what gonorrhea can be transferred. Then that takes us to the signs and symptoms of gonorrhea. In terms of the signs and symptoms, the first one I have to share with you is thick green or yellowish discharge. Thick green or yellowish discharge from the penis or from the vagina. Then the second signs and symptoms I have is pain during urination. So if an individual is experiencing pain whenever she wants to pee, whenever he wants to pass out, you're like, oh, I'm having this burning sensation in my penis, I'm having this burning sensation around my clitoris or the vagina whenever I want to pee, that might be a sign that an individual is having gonorrhea. Then the third one I have to share with you is frequency in micturition. This person is always going to the toilet to pee. Oh, I just peed now, but now I'm going again. That might be a sign of gonorrhea. Then the fourth sign I have to share with you is bleeding in between period. As a lady, during your period, you see your normal menses, you see your normal period, all of a sudden you are seeing it again weeks after. That might be a sign of gonorrhea. And for the men, they might notice some swollen scrotum, swollen testes. That might be a sign of gonorrhea that you should take note of as a man. So these are the various signs and symptoms of gonorrhea. Then that takes us to the facts I have to share with you today in regards to gonorrhea. And I'm going to be sharing with you 10 facts about gonorrhea. The first fact I have to share with you in regards to gonorrhea is that it affects both the men and the women. It affects both the male and the female counterpart. So it's not just affecting the man alone, or it's not just affecting the woman alone. So take note of it. It affects both parties. Then the second one I have to share with you is that gonorrhea can only be transferred from one party to another by unprotected sex. Unprotected sex can lead to the transfer of gonorrhea. Gonorrhea cannot be transferred by sharing the same toilets. It cannot be transferred by using the same towel. It cannot be transferred by using the same bathtub. It cannot be transferred by sharing one or two things. It can only be transferred when you have what? Unprotected sexual intercourse. Then the third fact I have to share with you is that these bacteria can grow in the reproductive tract and also in the throat. It can grow in the reproductive tract and the throat. And this bacteria can affect the eyes if you are not careful. It can affect the eyes. It can affect the rectum, the anus, the urethra. All these things, it can affect it. That's why I said it grows in the reproductive tract and also the throat. Then the fourth fact is that it is preventable. You can prevent it. And how can this be prevented? It can be prevented by abstinence from sex, avoiding multiple sexual partners, using condoms can also help to prevent gonorrhea. Then the fifth one I have to share with you is that the symptoms are not seen immediately you get that bacteria into your body. So for example, you had sex with someone that has gonorrhea today. You're not going to start seeing the symptoms, the signs and symptoms immediately. It's going to take like 15 to 20 days or even a month or 30 days for the signs and symptoms to be obvious. That's the incubation period. So take note of that. Then another one is that it can be treated. Yes, it's not a life sentence. It can be treated with antibiotics. The seventh point I have to share with you is that it can lead to infertility if not treated. It can lead to infertility, and we all know what infertility is. Like you're trying to conceive, you've tried for like within 12 months and nothing is showing up. So if you have gonorrhea, it's advisable you treat it, because if you don't treat it, it might lead to what? Infertility. Then the eighth point I have to share with you is that while treating this gonorrhea, please and please try and avoid sexual intercourse with your partner. Try and avoid what? Sexual intercourse while on medication, so that you can treat it effectively. Because you can be treating it and still having sexual intercourse with that same partner, and that bacteria will continuously remain. So try as much as possible to avoid sexual intercourse while treating gonorrhea. Then another point I have here, which is the ninth point, is that gonorrhea can be transferred from mother to baby. It can be transferred from mothers to baby. So it's better for you to do a proper test while you are pregnant or before getting pregnant, safe, to rule out gonorrhea, so you don't transfer that gonorrhea from the mother to baby. So if it's properly treated, it's no longer in your bloodstream, it cannot get to your baby. But if it's in your bloodstream, is not treated, it can get to your baby. Then the 10th point I have to share with you is that while treating yourself, let your partner get tested and also treat himself. Because if you treat yourself today, you get all the medication you need today, and you go back to that same partner having gonorrhea, definitely you are going to get it back. So while treating yourself, while you are getting tested, treat your partner and also get your partner tested too. And after all this treatment you've done, go back for some confirmation, go back for another test to confirm that it is no longer in your blood, it is no longer in your body system, and it has been fully treated. It's simple. When it comes to treatment, you go to the hospital, you get some dose of antibiotics. They might give you one injections or one IV infusion for the treatment, or you might be on oral medications. But make sure you follow up with the treatment. Make sure you complete your doses, because as a lady, if you don't complete your treatment, it will be an infection that is not properly treated. And when an infection is not properly treated, it might lead to pelvic inflammatory disease, and it might lead to infertility issues later in the future. So make sure you treat it completely. Make sure you complete your dose if you are placed on oral medications. After this video, I am not telling you to go to the pharmacy to get some antibiotics. I'm not telling you to go to the pharmacy to start treating yourself. Please and please see your doctor. Your doctor is in the best position to give you the best advice that are necessary for your health. This is more or less like an educational video to educate you, but not to tell you what to do immediately. What I have to tell you to do is to see your doctor and get the medications prescribed by your doctor. So this is just a short video explaining gonorrhea. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.